I have never been more hopeful than I am today about the future of brain tumor therapy. There are three pillars for care of brain tumors. One is the surgical pillar, the second is radiation oncology, and the third is medical therapies and neuro-oncology.
So how is a plan put together using all the available modalities for treatment? The first thing is to understand what the patient's goals are, and it can vary depending person to person and on the circumstances. Our job then is to help develop what is both a feasible and the least invasive way of managing that particular problem, so that treatment is as minimum as it can be, but necessary for best outcomes in the long term, including length of life and, importantly, quality of life.
Only the patient will know what is the best treatment for him or herself. First, you rely upon the medical team in front of you to advise you as to what we think might be the best for you. But in the end, it's your body. And so I think it's beholden upon us to give you some choices.
If we're trying to make the best recommendation for a patient, we want to be able to have honest, accurate information, the best as possible. So in general, we can develop a consensus. When we ask patients to make choices or decisions about their care, we have to be very careful about that. It's a huge decision and responsibility, and they haven't gone through all the medical training we have. So yes, there are times when the choices are equal and we need families to weigh in, but we also have a responsibility to give our best recommendation based on all the years of knowledge and experience that we have, and rely on us to all talk together and come up with plan A, B, and C. And maybe all three are acceptable, but we're recommending A first, B second, C third.
Just speaking to the general principles of Mayo Clinic, I think it's always important to remind patients and providers that all the providers at Mayo Clinic are salaried. There's no bonuses for treating more patients or prescribing a more treatment. So we really have removed any financial incentives from the treatment algorithm, which I think is good for the patients to know. That patient really knows that that provider has all the tools available at his or her disposal, whether it be external beam radiation, radiosurgery, proton beam therapy. And I think that patient should also know if there's no benefit to radiation, that's what the provider will tell them.
But there are also, other important factors. The general health of the patient. Is the patient otherwise doing well? Do they have any other coexisting comorbid diseases that would make it difficult for them, for example, to tolerate side effects from chemotherapy or side effects from a clinical trial? There's also the quality of life issue. Many of our treatments definitely are toxic. Sometimes there is a balance between providing therapy that can protect the patient's quality of life versus the length of life.
And very importantly, we check with the most important person in the room, the patient, and ask, this is our recommendation based upon our expertise and experience, but what do you think? Does this fit with your philosophy, your vision, and your perspective on your own health?
Ultimately, the decision we have made at Mayo Clinic in general is that the patient's needs come first, and other things are left aside. And there's certain decisions we've made fundamentally that allow us to do that.